Hi guys, that freaking autism mom here. Um, I wanted to share something that I experienced this morning. My son, I know I usually talk about my daughter on here. Today is about my son and my daughter. My son had a virtual appointment with his psychiatrist. My son, for those of you who don't know, is 19. He has severe autism. He's nonverbal. He needs a lot of assistance with day-to-day activities. He can display some aggression sometimes, but it's not an everyday thing. Um, our big issue right now is just getting him motivated to do things. Anyways, so we had a virtual appointment with his psychiatrist. He's seen the psychiatrist since he was uh, a little guy. So like over 10 years. Um, and we were kind of discussing like what was going on with him. And it's kind of, same old, same old. And just kind of out of the blue, she starts in with future planning because she said she's not getting any younger. She is an older lady. And she said, um, you know, she said she's not retiring right this second, but she is of the age where she's going to start thinking about retiring. And she said, I need to get things in place because no one else will take him because he has a severe autism. And she was not just talking about her office. So I kind of want to discuss that because I don't know another marginalized community that can be so blatantly discriminated against. And it's okay. And it's normal. And no one sees a problem with it, except for those, of course, that are dealing with it. I appreciate the heads up from the psychiatrist. I mean, it's not her fault. She's telling me point blank how it is. That doesn't make it right. And that doesn't mean that I'm going to stay quiet about it and just be like, okay, because I have lived a life with autism, with 2 children with autism. It was very hard when they were younger and had these behaviors to find help. And the help that we found wasn't always appropriate, didn't always work. Here's a news flash. Not everyone's autism looks the same. My daughter, for example, was okay when she was younger. And once she hit, about 7, she had some issues with the aggression and it went away. And then it came back with the, adolescent years. Both of my kids started having seizures when they were 15. So that was new. And I'm sure that had some effect on their behavior and things like that. But no, there's nothing put into place for the more severe autism. And I mean, we're out there. You don't see us because we're pretty much shunned from society. We have to, we can't work. We can barely go outside. We can never find caregivers for us to do anything. And just the way that, and again, I'm not saying anything about the psychiatrist, but she said, you need to prepare now. How am I supposed to prepare? How exactly do you prepare for that, knowing that as soon as she's gone, no one else is going to take care of him? And he has medications that he has to have for his psychiatric needs, and knowing that it's just understood that no one's going to take him. No one's going to, care for him. And she said, just take care of yourself because no one's going to take care of him. I can't write a prescription. I'm not a therapist. I'm not a psychiatrist. I'm not any of these things. But it's all going to be dumped on my lap because he has severe autism. And no one else will take him, and that's just okay. In our society today, with all the autism acceptance, you see the walks, you see the parades, you see, let's raise money for this. Well, that's not our kind of autism they're talking about. And I used to see this when my kids were younger. I would see, you'd see the Facebook groups and things, and somebody would be like, that's not our kind of autism. These things don't help our kind of autism. And I kind of was like, okay, I can see what they're talking about. And now I'm living it. So, I mean, I can't even get somebody to watch my kids so I can go to the store. And you're telling me I need to prepare for the rest of my life. The only reason I'm able to have a job right now is because my daughter is in a residential institution. And even that has a time limit because they don't deal with people that are adults. And autism does not go away when you are an adult. And this is not the only kind of discrimination and kind of blatant neglect that you have to deal with when you have someone with severe autism. I'll tell you another story. My daughter, I told you, had the issues that started coming up when she was an adolescent. And one of the symptoms, and I say symptoms because it wasn't always a thing, she would start banging her head. So I would take her to the emergency room because, there's no facility that will take her. There's a couple of facilities in our state. Usually they don't have any openings, and they are stabilization units that have a short time for, stay there. So they pretty much put you on a medication and ship you out, and you're, expected to hopefully, you'll be all right. So I would take her repeatedly to the emergency room, because that's the only way you can get them into a stabilization unit to possibly get help. And they would see her behavior. I would tell them that she has autism, and this is how it would start. Okay, well, she's headbanging. Is that a typical behavior? No. I would always say, no, this is not a typical behavior. This is a new behavior. This is a new symptom of what she's going through. I don't know what's wrong with her, but this is what she's displaying. So every single time, is this typical of her? Is this typical of her? Is this typical of her? And in the meantime, I'm looking at, gastroenterologists. I'm looking at neurologists. I'm looking at urologists. I'm looking at, gynecologists, any kind of ologist. I'm looking because nobody at the emergency room is looking for why she's banging her head. And here's the kicker too. So it starts out where you just have a primary care physician. And the primary care physician will be like, well, this might be, neurology. So you need a neurologist. Okay, so you go to a neurologist. And then later you say, well, this might be a gastroenterology issue. So you need to go to gastroenterology. So then you have all these ologists. And then what happens is they pass the buck. So you go and you'll start, say, at neurology, and you'll say, okay, well, she's banging her head. I don't know why she's banging her head. Can we get a scan or something? And they'll be like, well, before we do that, let's have her go to gastro. And they can see if she's constipated or she's having any issues. Okay, so you go to gastro. Gastro sees her. Gastro will pass the buck to the next one. Well, has she been to the urologist? Maybe she's got a urinary tract infection. Okay, fine. So then you go to the urologist. And this is all it's not like you're going to get an appointment the next day. This is like months and months and months of waiting while this stuff is still going on. Then you go to the urologist. The urologist is like, no, I don't see anything. Have you tried checking with their primary care physician? Maybe she's got some kind of just illness, like the same illness that she would have had, 4 months ago when I was at the top of the list. So this is what happens. They pass the buck, pass the buck, pass the buck, pass the buck, hoping that it'll go away. Meanwhile, we're living with it and it's not going away. And then every time I take her to the emergency room, okay, well, she's headbanging. Is this a typical behavior? No, this is a symptom of something that's going on. Well, guess what? She's been doing it so long now because nobody cares that now I just, her latest trip to the emergency room, guess what's listed as one of her active problems? Literally, headbanging is written on there. And you know why? Because now she's in the severe autism area and she can just be pushed to the side. Nobody has to deal with her once she gets to a certain age because as a society, we understand that that's what we do. So here's my thing. So if you go to the hospital and say you fell out of a tree and you broke your leg, and so you're not able to walk on that leg, and they say, okay, is this normal? Is this just how you normally walk? No, this is because I fell out of a tree. Okay. Well, if they don't treat that, if they don't reset that bone, you're always going to have that limp. Okay. My daughter does not have the verbal abilities to say what's going on. And no one really cares to investigate why she might be banging her head. You know, they just want to keep passing it to the next person, to the next person, to the next person. You know, you take your animal to the vet if they have an issue, if they're like, I don't know, maybe not walking on their paw, or, you know, maybe scratching at their ear. You know, the vet is not able to talk to the dog, but they're going to be like, okay, well, they seem to be doing something with their ear or their paw. So let's look into this. Let's get an x-ray. Let's get a, you know, a scan. Let's do something. I had to fight tooth and nail to get any kind of scan done on my daughter. And I don't know exactly what to ask for. So how am I, you know, these are medical professionals that should be looking out for someone that is in this position, like my daughter, and it doesn't happen. So I can tell you these things and I can shout from the rooftops. I'm not in government. I don't have the power to make things happen. What I do have the power to do is hopefully get some other people on here to tell their stories, so that people realize it's not just me. You can use a filter just like I do for privacy reasons. I have this channel and I also have another channel that is not filtered. So if you have something that you don't mind being, you know, have your face shown, contact me. That freaking autism mom at gmail.com. Okay, so here's what I've got so far. Basically, just by becoming an adult, my kids are just not going to get any kind of treatment anymore. That's becoming more and more obvious and being flat out told to me by providers. I've tried the normal routes to go and it's not working. So here's what I'm going to do. I was told to prepare now. So I'm going to ask my legislature, how do I prepare for this? How do I prepare for the rest of my life knowing that my kids are going to be discriminated against and neglected because they have a developmental disability? So, Senator Aaron Freeman, how am I supposed to prepare? State Representative Mitch Gore, how am I supposed to prepare? Congressional legislator Andre Carson, how am I supposed to prepare? Senator Todd Young, how am I supposed to prepare? Senator Mike Braun, how am I supposed to prepare for the rest of my life and the rest of my children's lives when we are not going to get the support from our government? Explain that to me. I would love to hear it. All right. That's my spiel today. I highly suggest you contact your representatives for your state, your area. If you're going through something similar, let them know what's going on so they can't ignore it any longer. Our voices need to be heard. If you don't want to say it yourself, you can email me your story and I can tell your story here, because these things need to be talked about and people need to know that this is an issue and we're not going away. All right, if you like this video, or at least it resonates with something that you're dealing with, consider sharing, subscribing, all that good stuff. And I will catch you guys on the next one, hopefully on a cheerier note, but it doesn't look like it's going that direction, kids. All right, bye.